Greetings, listeners, and welcome to the Care Table podcast, dedicated to educating and supporting family caregivers of aging loved ones. I'm your host, Amy Huddleston. Through insightful interviews from both industry experts and family caregivers, we aim to provide valuable perspectives and resources. Let's see who we're learning from today.
Welcome to today's episode of the Care Table. I'm Amy, your host. And before we get started, I want to remind you, please leave a review, tap the bell on YouTube to subscribe, leave some comments. Let us know if there are any topics you want to hear about that we haven't covered yet. We really appreciate the support. I am looking forward to this conversation because I heard about this product from someone that I used to work with at the Home Instead franchise. And I became curious saying, what exactly is this? And thankfully, I got to connect with our guest. Nancy Gillette is the Chief Growth Officer at Pocket RN. So thanks for being here today, Nancy.
Thanks for having me, Amy. I'm so excited to be here.
Great. Can't wait for you to share about what exactly this is. So let's start with that of just what exactly is, in simple terms, what Pocket RN is.
Pocket RN is a virtual nursing company that was founded out of the biodesign program at Stanford University with the goal of closing the gap between home and healthcare.
That's a simple answer. Okay, so I didn't have this on my list of questions, but what do you consider to be the gap between what you just said? There's the gap of home and the gap of healthcare. How would you define that?
So I define that, and we as a company define that as the millions of little moments that happen at home in between appointments and visits. So much of healthcare happens when you're not expecting it. And it's never it's never what you're thinking. And you learn by being in and out of the emergency room. You learn from being in and out of urgent care, realizing, maybe I should have limited the salt on a congestive heart failure patient, right?
Yes.
I knew the weight went up and down, but I didn't know what to do in the moment. And before I knew it, mom was in a full scale exacerbation. And, a lot of times what we hear from our patients and families constantly is, I left a message from my physician 5 days ago, and I'm still waiting for someone to call me back, because we have a really big crisis happening in the United States today, right? One of the little metrics, we didn't talk about this in advance, but I always like to share this with people, that 55% of nurses in the United States are over 50. Our nursing school enrollment is at its lowest level of all time, not because people don't want to be nurses, but we don't have enough educators to put people through programs. 11,000 plus people a day are turning 65 in the United States. And so we have a crisis on our hands. The same holds true for physicians. Physicians are retiring. We don't have enough going through the funnel. So we have a rapidly aging patient population, a very rapidly dwindling pool of clinicians who can support, and everyone has a backlog, right? So people are not getting to those voicemails. They're not getting in to see their primary care physician as quickly as possible. And so much of what healthcare is today and where we see it moving in the next 20 years is in the home, in those millions of little moments in between visits and appointments.
I'm just thankful that there's finally discussion about that, because it's where people want to remain anyway. So,
Yes.
Most people say, I just want to stay at home. I know there's a lot of caregivers that are trying to do that. They're trying to say, what can I do to keep my aging person at home? So what makes your approach different with Pocket RN that's different from this traditional, system that we have now?
Yeah. So first of all, with Pocket RN and our team, we have a support team that's available 24/7. So you can always speak to an actual human 24/7. And a lot of times families are calling in and saying, something's going on with mom and dad. Can I schedule an appointment with my nurse for tomorrow? Being a virtual company, we have nurses all across all 50 states. So it's a lot easier to get time with us. And really what I think is one of the most exciting things about our model, coming from the provider space, I've worked in the space for almost 30 years, really helping discharge patients home, helping them navigate home health services, home care services, all the things. And, really one of the things I realized when I worked in pediatric home health was that when I had a nurse that was working with a pediatric child, that nurse's relationship with the family was not transferable. they became part of the extended family, right? And so having that continuity of care, when you have a nurse who's very empathetic, but very clinically savvy, who can help you navigate, that trusted relationship is not transferable. And so I learned early on is that if my nurse left and went to work for another agency, the families went with that nurse,
Yeah.
right? And so something that I think that we really leaned on in the telehealth telemedicine space was that there was no continuity of care in a virtual platform. You got whoever was in the queue. A lot of times they were new grads. They didn't really have lots of lifetime, real world experience. And even if you hung up and called right back, which has happened to me, you can't speak to the same clinician because it's
Mm-mm.
not designed that way. And so we said, well, what if we could create a nurse for life model so that once we matched a nurse with a family, they would have that same experience that my pediatric children had with the same nurse who was in there on an ongoing cadence, someone that gets to know you, someone that knows your family, someone that becomes a trusted coach, advisor, support system for you that you'll actually listen to, that you feel like actually cares about you. And so that was really the model of care that we went out to design. And what we have seen is phenomenal outcomes. I mean, it's just unbelievable. We have a net promoter score at around 91.
Oh
So
my goodness.
families love us. They say, I listened to my nurse. The suggestions that they made were unbelievable. I'm so happy that I have this resource. And really, people, it's really moving the needle. Like our families will call us before they'll go to urgent care in the middle of the night, which is unbelievable.
Because you can reach someone. You're saying so any time of day, you can reach a nurse. So there's so much I want to unpack by what you
So
just said.
let me just go back
Yes.
and say it's not a nurse always. It's a support
Okay.
person. But
That's
that
okay.
support person can help you schedule an appointment with it. I always say we're not an emergency on-call service. Like if you have a 911 emergency, you need that. But you do have access to our team, someone that can schedule an appointment with you with a nurse, someone that can escalate if we need to, but you're talking to a US based human.
And when you feel so isolated at home, especially like you're saying, if it's 3 o'clock in the morning and let's say your person is wandering and you can't get them to come back inside, or, things are just getting escalated and you do feel so alone. And to be able to say, I've got someone that I know, whether it's a nurse or not, that I know is going to pick up the phone is
Yes.
right there alone is worth gold because it just lets them know you are not alone. So you said you're nurse for life. What
Mhm.
exactly does that mean for a client?
Yes. So that means that as long as you're proactively scheduling your ongoing touch points, you're going to meet with that same nurse throughout your entire healthcare journey. And I know we're going to talk a lot about the guide model of care, which is the guiding and improved dementia experience model. But in the guide model, it's a 7-year demonstration project. So once you're enrolled in the program under Medicare and you're with your Pocket RN nurse, you'll have your ongoing touch points with your nurse that knows you. So you don't have to tell your story over and over again. I mean, now there could be a time where if someone was on vacation, there'd be another nurse filling in, but it's not like you're going to talk to a different random person every single time you have a visit. And what's interesting is that a lot of times our nurses are actually noticing changes in condition before even the families do, because we get so used to seeing these patients and families that we're like, oh, something's not right today.
They can sense it already.
Mm-hmm.
So before we go into that CMS guide discussion, what do you feel is, I guess I'm more just going to ask like, what's the mission and or the purpose or vision of Pocket RN?
Yes. So our mission is to really give everyone the chance to care and be cared for in their home. And we do that by enabling our nurses to care through coaching, enabling our caregivers, family caregivers, to confidently support each other, and enabling patients to access care when and how they want in the privacy of their own. And I will
And
say something I want to mention because I think it's really important is that we have a partnership with a company called Navan. And Navan originally was a paid agency caregiver training platform to help agencies, home care agencies, meet state competencies. But when we saw the guide model, we thought, there's a really interesting idea here where if we could create more family facing content for training, right? Because like I said, family caregivers learn by going to the emergency room and realizing what they shouldn't have done. That's how we learn. We learn by making
Mhm.
mistakes
Yeah.
that are expensive. They cause hospitalizations, inpatient stays. And we really worked with the CEO and founder, James at Navon, and said, listen, we have this idea. We'd love to create more family caregiver content, training that is specifically for someone that's unpaid and untrained, who's dealing with their loved one. Could we create content? And we did. So when a family member has an exacerbation in the middle of the night and they're overwhelmed and they can't reach any of their other providers, they can take one of our trainings that we've created in the middle of the night as a reminder of what to do and what not to do in those situations. It's amazing. Like, families can access this content anytime, wherever they are, on their phone, on their laptop, and it's been wildly successful. We then also worked with Navon and we created a chatbot so that you could ask a clinical question to the chatbot via AI, and it would only search our clinically vetted content and not the greater Google. So, as you know, Amy, from being a provider yourself, when families Google things,
Mhm.
we call it Dr. Google these days, right? But when families
Yep.
Google things, they have 25 other things wrong with them that they didn't start when they were looking.
Mhm.
It's because Google is telling you all the possible things that could be going wrong. We're giving you the clinically vetted answer that is related to your mom and dad's dementia.
So, and let's specify that because I don't think we clarified. This program is specifically right now supporting families that are caring for somebody with some type of dementia.
Yes, the guiding and improved dementia experience model is specific to dementia. We
Okay.
work in other verticals. We do some care transition programs with some health systems. We've done in the past RPM and CCM projects with FQHCs and other stakeholders across the country. But right now, the primary focus has been this new innovation out of the Centers for Medicare and Medicaid that supports families and individuals living with dementia.
Do you think that's because that is the largest part of the population that's, I don't want to say draining the resources of Medicare, but am I close when I'm estimating that that's probably why that's the route that you went first is let's go for that population?
Yeah, I mean, this innovation, when the RFA came out and we looked at it, I mean, we as a leadership team, we all looked at each other and said, this looks a whole lot like the model of care that we just built, right? Really being able to support individuals in their home, supporting the unpaid, untrained family caregiver, having access to the same clinician that understands you, that builds trust with you, that helps you navigate, know what resources are out there. And then, of course, naturally coming from the home care and home health space, so many of my friends run agencies or work for agencies or own agencies. You know, the ninth care delivery domain in the guide model is respite care. So that a family member can utilize, it's almost 76 hours. There's a dollar amount that's attached, but they can use about 76 hours a year in respite care. So if you're a family member and you're at your wit's end and you're overwhelmed and you're stressed out and you don't know about home care because you've never used it before and you don't know anyone that's used it, this gives you an access to try these services out paid for by Medicare. And most of the time families are like, this made my life so much better.
Of course.
I really want to have this help. But people are reluctant to write the check and they're also afraid to invite strangers into their home. So when it's a fully funded benefit under Medicare, you're more likely to say yes. And so that's been very, very successful for families in this program.
So let's go back to talking about, to clarify, what exactly is the CMS guide program? But just explain, like in layman's terms, what exactly, first of all, when we say CMS, we're referencing Medicare. But when you say CMS guide program, what
Yes.
exactly is that?
So it's the Centers for Medicare and Medicaid's Innovation Center guiding an improved dementia experience. It is a no cost comprehensive program for families and patients living with dementia, and all dementias qualify. In order to be eligible for the program, a patient has to have traditional Medicare A and B and a dementia diagnosis. And that's really it. Now, there are a few exclusions. You cannot be on a Medicare Advantage plan. You have to be on traditional red, white, and blue Medicare. You cannot live in a memory care community. You cannot be on hospice. You cannot be enrolled in a PACE program. And right now, with Pocket RN, at least, you cannot live in a senior living community. Medicare changed some of the requirements in terms of assisted livings and the contracting needs, which is just super operationally not feasible to do. So that's an exclusion. But ultimately, if you have dementia and Medicare A and B of any kind, we can get you into this program. And once you're in, unless you hit an exclusion criteria, you stay in the program. And it's a 7-year demonstration with us. So it's going to so once you're in, you will have these services, and you'll have this respite every year. It resets on July 1, so it's use it or lose it. And a lot of families are using it because they're like, this is amazing. Even if they already pay for services, they're like, I can get a little more,
Yeah.
like about 2 weeks of extra care
Yes. Yes.
free. Like, this is amazing. And they love it. And so it's definitely been taking some of that stress off of family caregivers. And it's not just the respite. I mean, there are monthly touch points with our nurses. We have a social services team that's helping with community resources. We help families navigate. Do you need an elder law attorney? Do you have your advanced directives done? Have you thought about
Wow.
those? Most of the time, the answer is no. We haven't even thought about those. Do you want to live the rest of your days in your private home? Do you want to go to senior living? Do you need a resource for that? Like we do, do you need Meals on Wheels? Do you need, food services? And so we have a lot of partners that we have clinically vetted. I mean, music therapy, for example. So we have a partnership with an organization that does music therapy. So it's really like the nurse is spending a lot of time understanding what motivates this individual with dementia, understanding who they were prior to their memory loss. What do they love? If it was music, then we have a resource for the family. We work with memory lane games. They have over 3,000 games for people with dementia. And they're doing cool stuff with Mayo in the Accelerator program. There's been a bunch of white papers written about how amazing they are. So we really do try to work with the best in class other providers as we're helping families with the navigation services. And they love it. We do a med reconciliation. So we're looking to make sure that you don't have 3 different kinds of blood pressure meds that one provider ordered and the other one
Right.
didn't know. And then now you're taking 3 different at the same time. And then we wonder why you're off and dizzy and not feeling great. Right. So the nurses are definitely trying to support not only the clinical care, but also all of the emotional resources that are needed. And the one thing I always like to mention is that we're not trying to replace in-person clinicians. Like, we love our in-person clinicians. We love our home visiting docs. We love the home health agencies. They can all still be in there doing the things that we're doing. We're doing a lot of the emotional support for the family caregiver. Because really, if you don't support the family caregiver is the one that freaks out at 9 o'clock at night when they come home from work and puts mom and dad in the car and goes to the emergency room.
Right.
If you really think about it. Right.
Well,
So
and
these
or
services
often if it's the spouse, they are not taking care of their own health because they're so exhausted and overwhelmed. And what I hear that I love is I'm thinking from the perspective of the nurse, you're giving them also the gift of time, which they don't
Yes.
typically have when you're providing
No.
care. And let's say you're in the ER or you're even in the doctor's office, you don't get that amount of time to sit down and say, let's talk about music therapy or let's talk about your advanced directives. I mean, all of those things are desperately needed, but that now there's a program that's letting people spend that time.
Yes.
So when I was thinking about when you said you can have other agencies also still helping, I know that though with Medicare, for instance, like you can't have hospice care and home health at the same time because you can't double dip into Medicare. Is there any issue with, let's say, a home health agency is still coming into the home to do, speech therapy or physical therapy with one of your patients? If this is a Medicare program, how is that still allowed?
Because it's not a double dipping of services. When you really think about it, the speech therapist or the physical therapist, right, is in there doing a home exercise program, making sure that you're not getting muscle atrophy. They're really doing physical work with the patient. Occupational therapy is making sure that you're not, that you know how to use your oxygen when you're showering. We're not doing any of that. Those are very different services. We are really supporting that family caregiver. We are making sure that they understand their resources, that they know how to de-escalate. They know the signs and symptoms of things to look out for, right? We're helping that family caregiver with the respite to give them a break. And it's a totally different geo code. There's only about 320 of us in the entire United States that can bill the guide code. So home health doesn't even have the option to bill it unless they're a
Okay.
guide approved provider, which is very unusual that they would. There's a few, but mostly not. And we are one of the very few national providers for this program. So we are in all 50 states.
I'm just in awe of this. And I'm so excited that we're doing this conversation because people need to hear about this and feel like, the one thing that you hear a lot is people say, I just went into the doctor. I got this diagnosis of my husband who has dementia. My doctor suggested a medication or two and said, good luck. And I felt so alone. I felt like nobody could help me. And, financially, you might not be able to hire a home care agency, or you may not have the energy to even,
Start
consider
looking.
it or have, start that conversation. So when you say this program exists, for how do people find out, hey, can I use your services? Where do they go to do that?
There's lots of places. So this conversation in a podcast, we've had a bunch of people who have seen or heard a podcast that I've done and called in and said, my mom has dementia. Many people who know me know my daughter's on a national softball circuit. I have met so many families who are dealing with dementia, just even at tournaments. Like, it's everywhere. Everyone knows someone who has dementia. So people find us that way. We work with over 3,000 home care companies that are under contract with us to provide the respite all across the United States. Many of their existing clients that they're servicing today are eligible for this program. Those people's family and friends are eligible for this program, so they call in. Sometimes people go to our website. Sometimes they, heard me speak on stage. Like, sometimes they're coming right out of the hospital. They're newly diagnosed, and their doctor says, I'm not in this program, but it's a free program. You should try it out. And they come to us. Sometimes it's the Department of Aging. Sometimes it's leading age. Like, referrals are coming from everywhere. And I think that one of the, people always ask me, well, do you think there's any risk that the program's going to go away? And what I say to people is, this is one diagnosis. This is one issue that doesn't matter what side of the aisle you're on. If you are, it doesn't matter. Like, you are, when you're dealing with dementia and someone you love has it, you want solutions, you want resources. And so this is one of the few things I think that everyone can agree on. We have to do something differently. People want to be in home. It's the least expensive place to be cared for.
Correct.
Spending the time to answer your questions so you don't drive to the emergency room and get your question answered after a $10,000 or $15,000 visit that we could have done for you in 15 minutes at home on
Right. Plus
Zoom
a,
or on a phone
six
call.
hour wait time in the ER. It's all of those things. So is the website just pocketrn.com?
It is, yes.
Okay. And then you're saying you can just go to the website, you can fill out something or just say, this is how I want to find out if I'm eligible.
Yeah, yes. And also there's some improvements to the website coming, but there's a phone number you can call. You can email us at guide@pocketrn.com. When you call in, you'll get to support. They can send you over to intake. You can talk to the intake people. If you happen to know one of our home care partners, you can call them. Sometimes discharge planners fax referrals right over. Our fax number's right on the website, so you can fax a referral. Like, well, there's so many ways that people can get in touch. Sometimes people call me directly. They know me and they're like, hey, Nancy, my father-in-law is really bad. Can you help me out? And so, of
Yes,
course, I
I
put them
can.
in touch with the right people. So it's very similar to the way referrals come in for home health, I think, which is, a big part of my background was building Medicare certified home health care agencies. And so a lot of these referrals come in very similar ways.
Well, we'll put the website for sure and the phone number in the podcast show
Thank
notes.
you.
When families are just preparing to say, I'm going to reach out, see if I'm eligible, what can they expect in those first conversations with your intake team?
Yeah. So basically, the most important thing is we need to have the Medicare ID number, your date of birth, and your name. And then, of course, the zip code that the patient lives in, because that's how we determine the respite. So based on where you live, we have to have a contracted respite provider in your zip code. And that's really the most important things. And then we know very quickly whether you have Medicare or not. And then what happens is then we schedule a welcome call where we go over all the things on the program, answer all your questions, and then we schedule your visit with your nurse. And when you're the family caregiver, this is very important because there is something that the family caregiver has to do at least annually, but we prefer it to be monthly where they have the visit with their nurse. They have to complete the Zerit and the promise, which helps us understand how overwhelmed the family caregiver is, right? These are standardized tests from Medicare that the primary family caregiver has to complete on an annual basis. And we send that information off to Medicare. And that's how they determine whether you'll be respite eligible or not. You have to have a family caregiver, and then you have to complete those 2 tests every year.
Did you say Zerit? I've never
It's
heard
the
of that.
Zerit burden score and the promise. And so we're really trying to understand how overwhelmed family caregivers are.
I mean, I like that you're saying you try to do this monthly, not annually with your.
So the Zerit is annually, but we have monthly
Okay.
touch points with the families, with our nurse and the
Yeah.
patients.
I mean, I would imagine they're very willing to tell you how they're feeling.
Of course they are. And
Yeah.
people like I've been on this little soapbox personally for a really long time. And when I met Pocket RN, I was so excited because I was like, I think we can actually change healthcare for the better. Like, I just learned all of the pitfalls that my families were dealing with. And just having that availability, having a proactive approach to healthcare has been my soapbox for a long time. And, we don't do things proactively in the United States typically. We wait till you fall and break your hip. We don't order physical therapy when you fell and didn't break your hip, right? Like, I used to ask surgeons that all the time. I'm like, why don't we order physical therapy if someone fell but they didn't break their hip? Well,
Great question.
you get paid when you break the hip if you're a surgeon. You don't get paid to do physical therapy always, right? And I'm not saying people have bad intentions. It's just the way the system was designed.
Right.
And so with this guide model, we do have the opportunity to have these ongoing, proactive, more longitudinal care where we're constantly like checking in, noticing changes in condition. We're not waiting for the emergency that starts the cycle, if that makes sense.
Well, you're taking advantage of today's technology, first of all. You are letting people stay in their home and supporting them 24 hours a day, right? That there alone is enormous, that any caregiver knows you are not alone. You have somebody that you can speak to at any time that's going to listen to you and at least direct you to some resources, whether it's the online training you offer or let's schedule a time, at 9 a.m. to speak with your nurse. At least I have support and I don't feel alone. I mean,
Mhm.
that just I would love to know with your surveys that you're doing. I don't know how long the program has been in existence, but what have you seen as far as when you've started and where you are today with just patient and caregiver satisfaction?
It's 91%. It's through the moon. I mean, I've never if you were at a 50% net promoter score in healthcare, and that's good. We're at across, and I have to say across all of our patients, not just our guide patients, but across all of our patients in our whole company, we're at 91%.
That's
I
just
mean,
insane.
it's insane. Families are like, I don't know how I survived without you. I mean, it's really like the name Pocket RN really came to be. Our CEO is a family caregiver. She lives out of state from her mom. Her mom lives much closer to me in New England. And it was like always relying on the nurses in your ecosystem. One of my best friends in the planet is a nurse. I'm telling you, if I have like a rash or I don't know, sniffle, I'm calling her freaking out constantly. And really, it's that nurse that's in your pocket. You start to realize if you do have a friend that's a nurse, you
Hmm.
call them all the time, right? They
Right.
become the trusted person for you. We wanted to make that access, democratize that access to a nurse in your pocket. We think everyone should have a nurse that's a trusted clinical support for you who can coach and teach and educate you so that you don't end up in the hospital.
What is a story that you could share with us, obviously without sharing names, of just a recent example of someone that's been using Pocket RN?
Here's a good one. So we had a patient in their 90s, and the daughter was very concerned because their loved one was losing weight very quickly. They weren't participating in activities, felt very tired. And our nurses realized that this individual had Ozempic ordered for them, and had been taking Ozempic. So the daughter was about to roll this person into hospice for failure to thrive. And we're like, wait a minute. So then our nurse called the physician and said, I don't think this is a good idea for whatever reason. What if you, even if you're trying to manage A1C, right? Like whatever it is that you ordered it, it's not working for this individual. We got it discontinued. Within a couple weeks, this individual was back participating in activities, gaining weight, super happy, would have been on hospice. It could have been a whole very bad situation, but it wasn't. And that's just one example of the things that when you have the time to pay attention, you can find.
And because they can reach you at any time versus you were in the doctor, you have to wait. If you call to go back to the doctor, it
You're
often will
waiting
take
6 weeks.
yeah, or longer. I mean, you can't even I think today, yeah, it's hard to even get in within a week. So I can understand just the benefits of this are just endless. When you said you can qualify, you have to share your zip code, you have to be on Medicare A and B, but you mentioned sharing the zip code is where you're looking at whether there are respite home care agencies that are in the area that are participating, that can provide that respite care. Can you still use Pocket RN if Pocket RN does not have a relationship yet with a respite provider?
So we're supposed to make sure when we accept a referral that we have a provider that can provide the respite, if in fact.
Okay.
But I will say that we're very fortunate that we do have 100% of the zip codes in the United States covered under zip code coverage right now.
Well, that's amazing. Okay, so
Yeah,
that
even
shouldn't
in
be a
rural America.
limitation.
Yeah,
How are you doing that?
30 years of and lots of friends, I guess.
I mean, that's really phenomenal. So let's explain a little bit more about that respite. So not everybody always understands what that is. So let's say you right now I'm getting the support of my nurse for life. I can call 24/7 and speak to somebody. I can use your online training. And then you're when you have that primary caregiver, they are often sometimes at their breaking point, sometimes completely exhausted, and you'll hear the term respite used, where sometimes, for instance, like a facility will say, we'll offer you a 5-day respite stay, or, a hospice unit does that. But when you say in the home that respite is available, what do you mean by that?
So, what that means is we work with home care agencies across the country, and the respite, like I said, it's approximately 76 hours a year. You have to schedule it in 4 hour blocks or 4 hour increments. But you could, for example, we have families that will say, okay, I want to have an 8 hour Friday once a month. We had a family member say, I haven't had lunch with my sisters in 3 years because I can't leave my loved one alone. And so they can leave for the day. We'll have a caregiver from the agency, the home care agency that's contracted with Pocket RN, go out to the home and do the 8 hour shift. And they're going to, make sure that individual is eating and make sure that they're, safe at home and not wandering out of the house. And that family caregiver can go do whatever they want for that 8 hours. And so, like I said, some people are going to have lunch with their family and friends. We have some of our female caregivers have said, I want to go to the hair, get my hair done. I haven't had my
Yeah.
hair done in a long time. Like I want to go get a facial, a massage. Maybe I'm so stressed out. We've had some of our male caregivers say, I want to go fishing, or, I'm going to go do X, Y, anything you want to do. Like you can go do it.
Right.
So, our family caregivers are unbelievable and they do so much work. And sometimes it's just really important that they have some self-help time so that they can regroup. There's a crazy statistic that I saw the other day, and it was like 63% of family caregivers die before the person they're taking care of because they're so overwhelmed and stressed. And I believe it. I
I
believe it.
saw it all the time in my home care agency. It is absolutely a true statement because they don't go to the doctor. They
Nope.
don't get the sleep that they need. They
Nope.
aren't probably taking their medications properly because all they're doing is focusing on caring for their person. It is 100% true statement. And when you say they need that oxygen, they
Yes.
just need to get out and be themselves. And just that I'm just thrilled that Medicare is understanding that this is part of healthcare, that you
Yes.
have to take care of the caregiver if
Yes.
you want to keep these people at home. And like you're saying, it's less expensive keeping them at home than moving into facilities or being in the hospital, once a month or once every few months. So it's just, I think you've just completely opened the door for the data that Medicare needs to see that says this is going to work. It is working clearly.
It's
If you have you're just like when you were saying that net promoter score, I'm thinking, when I have friends that ask me, I'm looking for a facility for my mom, and I just kind of take a deep breath and say, you're going to start searching. Let's say you look on Medicare.gov and it's not good. I mean, the star ratings that you're going to see are not good. And if you see a decent one, it's pretty rare. So when I hear a
and they're hard to get
90,
in. The good ones always have a waiting list.
always, but
Always.
it's because I hate saying this, but there's not as many good ones. So if you have a product that has a 91 net promoter score of their patients, I mean, that's 5-star. You've got a 5-star government funded program, which is like, I'm sorry, what?
This is a game changer. This is what healthcare needs to be. Like this is 30 years of learning as a provider, you know, witnessing the gaps in care, understanding the challenges that families were facing, really innovating a category. Like Pocket RN has been innovating a new category of care. No one ever says we're going to doctor you back to health. It's we're going to nurse you back to health, right? And
So
nurses have
true.
largely been sort of beaten up at work. They haven't been listened to, they haven't been valued, they haven't been heard. I mean, there's been so many strikes with nurses that are just like, you can't make these ratios worse,
Work.
right? I
Yeah.
need more support. You need to listen to me. I should have a voice at the table. And we very much believe that nurses need to be valued, respected, heard, understood, and they really are the people that nurse you back to life, to health. It's not, we don't doctor you back to health. Our doctors are important, but our nurses are really the ones that do so much of the work. And so this model of care is really putting that front and center. And so far, the families have very much responded to the positivity of this model of care. They love their nurses. Nurses love this work. I hear every day, it's so rewarding. We have never spent a dime recruiting nurses, ever.
What?
No, we don't. So we don't have to, because when nurses come to work here, they tell other nurses how amazing it is, and then they tell their friends. And it's just like the word of mouth with patients, right? These adult children are telling all of the kids at the book club. Yeah, guess what? I mean, I'm on the softball field, and everyone's like, "Oh my god, I got to sign up my dad. My father-in-law needs this." I mean, family caregivers also, by the way, let's just acknowledge the fact that they come in all shapes and sizes and all ages. I've been a family caregiver since I was really in high school. My grandmother had Alzheimer's and dementia when I was really young. And, but a lot of family caregivers that are young also have not been through these experiences before. So giving them the tools and resources, they don't have the life experience to have learned all of the mistakes that I learned when I was, 14 as a family caregiver to my grandmother. I would have much rather have someone give me some online training to understand what I was dealing with, not to kind of learn as I go. Back then, of course, I'm so old, we didn't even have the internet back then. So, like, you know what I mean? Like, there wasn't a whole
Yes.
lot of research. And now we're just able to feed this information, to family caregivers that are of all ages and shapes and sizes, so that they're equipped for the job that they did not sign up for.
We at my home care agency used to have nurses that had retired, and they came to apply to be caregivers with us because they said, I want more one-on-one time with these
Yes.
people. I'm not going to
Yes.
do the nursing anymore. I'm going to become a non-medical caregiver, but I want that one-on-one interaction. And that's what you're also giving them as an employer, is they're getting that time with these patients, and they really can help them, and not in just the medication or the therapy or whatever. It's everything that you're talking about, that you're helping them thrive at home. And do you have any statistics about, when you first started the program, and keeping track of maybe hospitalizations of your patients? What have you seen happen as far as when you first started to now, on I would imagine you're seeing fewer people going to the hospital.
Yes. So across all of our patient populations, we know that our minimum baseline of reduction in unnecessary inpatient stays is 30%. And
Okay.
in some cases, it's significantly higher than that. It just really depends upon the patient population and the location. But 30% with all of the patients that we have across all of our verticals is insane.
It's insane, and I'm sure Medicare
Insane.
is just like they're skipping around the room because
Yeah.
you can't do that. You I mean, have they ever done that?
No.
No. This is
And
unreal.
it's really like, Medicare, what I'm so excited about is really the future of healthcare because I think, just from being in the space for so long, Medicare is really realizing the things that most of us that have been doing this as providers for so long know that home is the safest place to be. Right? You don't get community infections when you're at home, where your neighbor has, MRSA, and all of a sudden you have it now because you're right next to them. So you're safer at home. People want to be home. Home is less expensive, right? Being proactive is better than being reactive. And I think that Medicare is really focusing on the future and sustainability of the program. And, there's been, like what I say to home care providers is this is so massive because you, in general, as a home care operator provider, have never been in the conversation that home care is healthcare. I have
Mm-mm.
been in so many rooms, focusing on reducing and avoiding hospitalizations that had nursing homes and rehab facilities and acute rehabs and home health and hospice and all these different people. And who was never in the room, who was never sitting at the table ever, was home care. I'm like, you never had a place at the table. People didn't even acknowledge you as being part of healthcare. And now this program not only brings you into healthcare, but it gives you a front row seat. And Medicare is now starting to talk about home care being a covered benefit in the long run because they're already seeing the amazing effects of this program. So, I mean, it's so much bigger than just the one guide program. It's so much bigger than just the respite. It is the whole entire model of care that Pocket RN was founded on. That before guide even was a thing, we were already doing this. We had already built it, so we were just so excited to have a payer source. And I do see in the future, I'm hoping that it'll expand into some advantage plans. I think there's lots of opportunity to focus on other disease processes down the road. It's just the beginning of what I think is the future of healthcare.
I mean, you just said so many things there that, first of all, my heart is beyond happy that home care finally has a seat at the table. I opened my franchise in late 2004. And I will never forget when I started to go market to facilities or the hospitals, I, c- I couldn't believe that people would say to me, no one's going to pay for this.
Right.
What's the benefit? There's no use, why would anyone want to use this service? And I saw time and time again that home care changes lives.
It does.
People think of it as, oh, it's just a companion coming over. And it is so much more than that. It is, it gives you a purpose to get up. It gives you a purpose to get ready for the day. You have somebody to interact with that you're going to have a conversation with. You might, get outside for the first time that week. You might go and, go out to lunch, which you haven't done in quite some time. But I saw it time and time again change lives. And it's been a very long time coming, but I'm fine. It's better late than never. But we deserve a seat at the table because
Yes.
these caregivers are angels for what they
Right.
do. And they come in there and they're not there to just, oh, I made a meal and I left. I mean, they are there because they want to create a relationship with this person, not even just with the patient, but the caregiver. And just
Yes.
say, I've got you. Like you go
Right.
out, right? Like you go out to lunch with your sisters, I've got you. Everything's going to be fine. I know what I'm doing. And I'm thrilled to hear it. I'm also happy to hear that you hope this will eventually expand into other, modalities, whether it's, I don't know that, what, like diabetes or whatever it might be that people are having a hard time managing. But this is a great first place to start with dementia.
There's just so many people with dementia, and we know there's no cure, right? I mean, there's a lot of things you can do for diabetes. You might not, if you have type 1, obviously it's not going to go away, but there's a lot of people that with diet and exercise and changes with type 2, they start to do better. And, but we don't have that for dementia, right? We don't have that for
No,
Alzheimer's.
no.
And some people are just in so much denial about it. And it doesn't go away, right? So this is something that is a longer term, progressively worsening disease that we have no solutions for. And this program is just such a game changer. We had a family who actually got to go to their son's wedding because they could use the respite money to have a caregiver, and said, I wouldn't have been able to go because I can't leave. And so we hear stories like that time and time again every single day about how this program gave them so much hope. We had a family come to our conference, and the mom and dad had been married almost 65 years, and she got really bad dementia. And he said that some days that my nurse was the only person that I got to talk to who wasn't yelling at me all day, and someone who was able to, just hear me when I just needed to talk to someone. And literally, we were all in tears. Like
I'm
it's just
crying.
like,
Yeah.
just like seeing the real world impact that it has. I think that people don't realize how isolating being a family caregiver is. And most of us try to hide the fact that we're family caregivers because, we have jobs and we're working and we're trying to do a lot of things. And the person you're caring for doesn't want their business all over, whatever. Right. And so
Right.
there's so many people suffering in silence, I think, that are family caregivers. And being able to access our team from the privacy of your own home in a trusted way does give you that relief. There's just, like I say, there's just so many benefits to this program, and many of them aren't even seen to the outside world, but we see it. And it's a great reason to get up out of bed every day.
Oh my gosh. I mean, the other benefit you had mentioned that I think is 100% true is we saw so many times over the years, people were so hesitant to try home care.
Hmm.
Obviously, there is a cost associated with it. It is typically private pay. You're going to have a stranger come into your house. There's all these barriers that make it very hard for someone to say, yes, I want to do this. But this is amazing because you don't have to worry about the cost. The agency's already been vetted because this is an agency through Pocket RN. We're taking care of this for you. You just need to say the word and we'll schedule it and we'll make it happen. So do you schedule it? Does actually Pocket RN reach out to the home care agency, or they just work together?
Yeah. So when we get the referral and we check, then we send it out to our home care partners and we ask if they want the referral. We still have to go through, getting the comprehensive assessment done and getting everything sent. And Medicare has to then send us, yes, they're approved for respite, or no, they're not. Most of the time they are. Moderate to severe complexity dementia with a family caregiver qualifies. If you're low complexity, every now and again, someone's low complexity and they don't qualify, but we'll know. And then the family works with the home care agency. They still have to sign some of the agreements with the home care agency because, there are rules in place on how home care agencies have to operate. And then they work with the home care agency to decide how and when they want to schedule it and what the good timelines are and how it all works. And then the thing is, it's use it or lose it. So you have to use your hours before June 30th. And then on July 1, you'll get another 76 hours
Okay.
the following year. And
I hope
so
they're all using their 76 hours.
we're seeing 95% of the families using the respite with Pocket RN. And the other
I'm
cool thing
so
that you
glad.
mentioned is that Medicare does a background check on the agency owner, and they look for anything that's out of compliance. So you can't just hang up a sign and say you're Nancy's Home Care and I'm going to provide respite care. You have to be a legitimate agency. You can't be on an OIG watch list. You have to be in good standing, and Medicare has to approve you in order to work with us. And they have to basically tell the home care agency or tell us this home care agency is now approved to provide respite on your behalf. So there's a whole process. So they're definitely making sure that, there's good quality providers that are doing the right things coming into your home.
Again, you're taking another barrier away for these families. So it's a team of people that are supporting the caregiver and the patient in the home where they want to be. I'm blown away by this. And I really hope that it continues to expand into other modalities and that this is the future of home care because it's the way to go. I mean, I'm a big fan. I've known it for a long time and I know you are too. So hopefully we can see that happen sooner than later. Is there anything else that we missed about the program? Obviously I'll put in the show notes the website, the phone number, anything else you'd want to share with listeners to understand about Pocket RN?
No, I just think, they always say it takes a village to take care of children. And I think it takes a village to take care of seniors too. I think that we all need to break our silos and collaborate more. There's plenty of room for all of us to do the things that we specialize in to really be able to support individuals in their, quest to live their days at home where they want to be. And I just think changing that mindset is really what is the primary goal, at least for me personally, to see that you can still be a home health agency and taking care of someone, and I can be a virtual overlay. Having a virtual clinical overlay to an amazing in-person caregiver to support not only the caregiver, but the family caregiver and the patient together is a game changer, right? It's the secret sauce. It's just the secret sauce. So, I just hope that if you know someone that has dementia and you're not sure, reach out. If for any reason you don't qualify for the program, we work with the Alzheimer's Association. We work with lots of organizations that have programs. We work with Hilarity for Charity, right? Like we work with a lot of places that we can resource you to. And there's so many programs out there that people don't even know about. So it's never not a good connection to make.
That's so great. I'm working on an episode, hopefully, with Hilarity for Charity. So I'm glad that you mentioned it because I want to talk about what they offer as well. But this just, I'm so happy to learn about this, and I can't wait to help spread the word. And I hope you get some phone calls from this because it is a gift for families. And I have to give kudos to Medicare for saying yes to it. Please keep saying yes to it because it's the future and it's what people want and what they need.
Yes.
So you're keep doing the great work, Nancy. This is awesome.
Thank you so much. Thank you so much. I feel so blessed to get to be on this today with you and to share the message and just to help these families. I've hit the wall at 90 miles an hour, I feel like, as a family caregiver, and you don't know what to do. And so it's just nice to have this program.
More than nice. So thanks. Keep up the great work. And thank you so much for your time today.
Thank you so much. It was great to see you.
Thank you.
Have a wonderful day.
You too.
Okay, bye.
That's a wrap for today's episode of The Care Table. Thank you so much for joining me. If you found this information helpful, would you like, subscribe, write a review, or share this episode with someone that you feel could benefit from hearing this information? I'd sure appreciate it. If you learned of anything during this podcast as far as books, resources, or products that you might think are helpful, be sure to check out the podcast show notes for links to access that information. A friendly reminder that this is not medical or legal advice. This is just information. Consult a professional for your own personal situation. I ask that God would bless you with the wisdom, the courage, and the strength that you need as you're navigating this caregiving journey. And I want to remind you, you are not alone. I appreciate you joining us today. And until next time, stay strong, and I hope to see you at the Care Table.